When we explained what is diabetes, we had spoken about the three kinds of diabetes, with type 2 being the most common. Type 3 or gestational diabetes is a temporary form of diabetes which happens only to pregnant women during the duration of their pregnancy. What causes gestational diabetes? When a woman is pregnant, the placenta produces hormones which can lead to a buildup of sugar in the blood. The pancreas overwork usually to make insulin to handle that excess sugar, but in certain cases that does not happen. That is when these pregnant women suffer from gestational diabetes. What are the risk factors for gestational diabetes? Being overweight or obese before pregnancy. African American, Asian, and Hispanic people have a higher chance of gestational diabetes. Diabetes is a hereditary problem in the family. The woman suffered from pre-diabetes before getting pregnant. Gestational diabetes during the first or any other pregnancy previously. Had PCOS or polycystic ovarian syndrome previously. Does gestational diabetes remain after the baby is born? No, it does not. After the baby comes out of the womb, the mother might not suffer from gestational diabetes anymore. But yes, having gestational diabetes does increase the chances of type 2 diabetes immediately or later in life if care isn't taken. Does gestational diabetes affect the baby? Gestational diabetes does not give the baby diabetes or increase the chance of type 1 or type 2 diabetes. But yes, it does put the baby at an increased risk of being overweight at birth. Extra glucose in the mother's blood crosses the placenta, which makes the baby's pancreas produce extra insulin. This can lead to the baby growing too large, which is known as macrosomia. Apart from that, there could be some other complications as well. How is gestational diabetes managed or treated? Gestational diabetes cannot be treated during the course of the pregnancy, but of course it can be managed. This includes checking the blood sugar levels multiple times a day. There are also routine urine tests to be done to check for ketones. A healthy diet as well as moderate exercise might also be recommended by the doctor to keep the gestational diabetes under control during the term of pregnancy. In some women, especially those who are obese, medications or insulin injections might be prescribed.